Hello, welcome back to the mat. Today's video is all about if you have those sticky spots in your low back, specifically around the sacral area, which is going to be that nice flat bone at the base of your spine. It's also going to be about sciatic nerve pain. So if you get any of that pain referral down one leg or the other, perhaps when stepping, maybe you notice it's more aggravated when doing things that exert force downward with your arms. Often people will notice this flaring up after shoveling snow or mopping the floor or something like that. Pregnancy also tends to bring it out. And it's inspired by a friend who is asked for some movement. They caught their heel edge on a snowboard, took a tumble, and aren't sure if they've got some bruising of the bones, if they've got some compression in their spine, or if it is truly in the muscles and fascia. And so if you are having any kind of mystery pain, this could be a little bit of a diagnostic for you. It would be something where after the class you might notice something, but especially tomorrow, you might have some input on where this pain is or at least isn't coming from. But it's also going to be some nice movement for anyone who just generally feels any stickiness in those regions. We're going to get into the hips and the low back and, of course, that sciatic nerve area. So feel free to use this as its own practice, or feel free to integrate these movements entirely or in part into movement of your own. But for the purpose of this video, we are going to go ahead and start lying on our backs. And you can have your knees hovering toward your chest. And you might rock a little side to side until you feel like you have everything kind of settled onto the mat. And then while you lie here, draw your attention to those three convex curves on the back side of your body. That would be the bowl of the pelvis, the shoulder girdle, and the back side of your skull. And see if you can let those three zones become really heavy on the mat. You can begin to focus your breath, noticing on the inhale that expansion from front to back, side to side, top to bottom. And likewise, on your exhale, the contraction from all of those directions. So you feel ready to start some movement. Keep that breath, keep the heaviness in those curves, but bring your arms out to a T. Hover your knees to more of a 90-degree angle. And we're going to draw them in toward left armpit, away through center, and in toward right armpit. And as you do this, you can pick up speed or slow it down. Keep those three zones really heavy. That's going to change to what extent you draw your knees over. And essentially, we're starting to mobilize and loosen some of the fascia of the low back surrounding the pelvis, getting a little bit into the hips. Return to your breath and those curves on your back. And you might continue this for 3, 2, and 1. From here, let's go ahead and flex the feet as though you're going to plant them on the ceiling, and then draw your knees away from each other, almost like in an arms-free happy baby form. And begin to rock a little bit side to side, still keeping weight in those curves of your back. And then return through the center, and using one or a couple of rocks, you can come up to a seat. Hands behind you, feet as wide as the mat. Let's begin to do some windshield wiper movements through the legs. The next time your legs are over to the right, go ahead and pause them there and bring your torso upright. If this feels pretty unsustainable, you can slide a block underneath your right sit bone, and that might make this feel better in your body. If you're fine here, go ahead and stay here. Torso's gonna stay pretty upright, and we're gonna lift that left knee while keeping the foot in contact with the mat. And we're trying to keep the torso, again, quite still, isolating this movement into the hip. We're getting into some of the tissues surrounding the hip socket. And you might continue this for 3, 2, and 1. Go ahead and lower that knee on the mat. And then, looking perhaps even a little bit more to the right, we're going to lift that left ankle and lower. Lift and lower. Now, these might be quite small movements. That's totally fine. This is a tricky range of motion. Even if your foot doesn't leave the mat, if you can still feel engagement, that is great. And you might continue for 3, 2, 1. Land that foot, lift your knee back up, press your left hand to the outside edge, create some resistance here. And then as you lower your knee back down, just notice if your left sit bone is a little closer to the mat, or if you feel any settling through your pelvis. And then we'll come back up through center. Hands come back. I like to lift my hips and kind of reset them and begin those windshield wiper movements again. And this time we'll lower both knees to the left and bring the torso up. Right foot stays to some extent in contact with the mat as we lift that right leg and lower, focusing on keeping the torso out of the movement as much as possible. We don't want this to be a core targeted workout. Of course, your core is here, it's involved, but we're wanting to isolate this movement. And you might continue for 3, 2, and 1. Lower that knee. Maybe look a little bit more to the left. We're going to do those foot lifts and lowers. Mine's obviously pretty small movement. And you might continue here for 3, 2, 1. Lower that foot. Lift your right knee back up, right hand to the outside edge, create some resistance. And lower your leg down, check in with your pelvis, notice your sit bones. Legs come back up through center. And from here, we're gonna rock our way over into a tabletop form. So you might actually take rocks, or something I kind of like to do is to come up through a malasana and feel that out as I make the transition back to hands and knees. Now, a difference here is that we're going to bring both knees and legs together, right? So we don't have knees under hips, they're narrower than that. You can tuck your toes under here. We're gonna begin to wag the tail. Press into your hands, keep your shoulders square. So again, this movement is a little more isolated. Continue for 3, 2, 1. Come back through center. Plant your knees beneath your hips. Right leg's gonna come up out to the right and draw some circles with that knee. And then the other direction. And then go ahead and kick it out to the right. Plant your foot facing forward, about in line with your left knee. And then from here, we're gonna pulse back and forth, finding some stretch in that inner right leg, perhaps. The next time that you come back, if it feels sustainable, you can crawl your hands forward, tent your fingers so that your heart really grows heavy here. Maybe your forehead touches the mat. Keep some engagement in your right foot, maybe even micro bending through that knee if you feel that you're hyperextending at all. And inhale, back up through center. Right leg's gonna bend. We're gonna bring knee toward bicep or toward your armpit and begin to circle that leg around and then the other direction. And go ahead and land your knee. Feel side to side, just noticing differences here. We'll go to the other side. So left knee lifts out to the side, find some circles with that leg and hip. And the other direction. Kick your left leg out to the left, plant your foot toes pointing forward in line with your right knee, and find those rocks to and fro. Perhaps landing back and holding in stillness while your fingertips tent forward and your head grows heavy toward the mat. On an inhale, you'll return forward. Left leg's gonna bend. We're gonna bring that knee up towards your arm and circle through your ankle or shin any amount, and the other direction. Something I got from one of my teachers, Lydia Zamorano, and I love it. Go ahead and bring your left knee back. Again, wiggle it out, feel through it. And from here, we're gonna make our way into a downward facing form. So, just as we did in our tabletop, we're gonna step feet together. And again, wag the tail here. When you feel like you have done that enough, we'll begin to make our way to the front edge of the mat, either tiptoeing or hopping, stepping. Let your knees be pretty soft here unless you're quite warm. And then from here, inhale, halfway lift, long spine. Exhale, fold. Inhale, halfway lift. Exhale, fold. Inhale, halfway lift. Pause here for a breath. On your exhale, you're gonna fold, but this time in your fold, you're going to utilize some head movement. So start by really pressing down through your feet, evening your weight distribution between your front edge, back edge, outside and inside edges. And then from here, thinking of your hips being the highest point in your body, you're gonna tuck your chin in and look at your belly button, maybe even thinking of looking at your sternum. And then lengthen your spine, look forward, tuck, and look forward. Now, if you're doing this and you're like, what's supposed to be happening? You're not feeling any nerve engagement, then that means you're probably not dealing with sciatica right now. But if you are feeling some nerve engagement, this is a great way to floss your sciatic nerve. All right, let's go ahead and bring that to a close. We're gonna bend into the knees and land down in a seat. Kick your legs forward. We're gonna do that same thing, except one leg at a time now. So let's bring right leg out toward the right, left foot comes on the inside of the right leg, figure four. Flex your right toes back, maybe add a micro bend into your right knee. As you crawl to frame out your right foot, same thing. Tuck in and look up. Tuck in and look up. Just one more. Crawl back up, switch your legs. Crawl out. Tuck and look. Tuck and look. Last one. Crawl back up. And then from here, both legs come forward. All right, so again, that could be a micro bend in your knees, toes flex back, crawling forward, making sure to really hinge at the hips. Try not to just round through your shoulders here. So think heart forward, shoulders back. And then from here, tuck to round in and look up. In and up. In and up. Round your way back onto your mat. knees come in, and our closing form is going to be one hand on the near side of the knee, one hand on the far side. So it doesn't matter which you start with, but one hand's on the far side of the knee and one hand's on the near side. You're gonna let your legs hug in toward each other and then just create resistance. So one of your knees is drawing in and that hand's pushing away, and then it's the opposite on the other side. And slowly release that and switch your hand placements and continue. Build back up and release. Once more each side. Build up, release. So build up and release. Now, if you are dealing with some funkiness in your low back, you might find it nice to end with legs up the wall or else with some support under your sacrum, maybe elevating it a little bit. Sometimes that creates spaciousness. So something like a block underneath that nice flat bone in your low back could feel supported here. And feel free to stay as long as you would like. Hopefully, by the end of this mini flow, you have a better idea of if you're dealing with sciatica, if you have some stickiness in the fascia of your low back, or if perhaps what you're feeling and experiencing is something else. I hope that this is helpful. Please leave any comments if you have questions or concerns or anything along those lines. Thank you.